Let's study about the bacillary dysentery. Bacillary dysentery, as the name says it is caused by bacilla and there is the dysentery. Infection of the intestine by Shigella or Salmonella. Shigella or Salmonella, causing diarrhea that contains blood or the mucus. When there is diarrhea that contains blood or the mucus, it is called the dysentery. So this is caused by the Shigella and Salmonella. Mode of transmission is fecal-oral route. Causes. The causes for the bacillary dysentery are the eating contaminated food, drinking contaminated food, contracting dysentery from another infected person. Clinical features. The patient presents with complaints of blood or mucus in the stool, vomiting, abdominal cramping or bloating. There is high fever, weight loss, loss of appetite. For the investigation, we do the stool routine examination, and in stool, we see the presence of cyst or a bacteria. We can do the stool culture, where bacteria grow in culture medium in 48 to 72 hours. We do the complete blood count, in which we can see the decreased hemoglobin due to loss of blood, eosinophilia in parasitic infestation. We can also do the blood test to see the presence of the antibodies. We can do the colonoscopy to check bowel. For the treatment, we give the antibiotics. If the bacillary dysentery is due to Shigella, after we do the stool culture, we get the result that whether the bacillary dysentery is because of Shigella or Salmonella. When it is because of Shigella, we give the cotrimazole 8 to 10 mg per kg or BD for 5 days. If it is due to Salmonella, then we give ciprofloxacin 15 mg per kg or 500 mg BD for 7 days. We also give zinc if the infant is less than 6 months, then we give 10 mg zinc for 14 days, and if the infant is more than 6 months, then we give 20 mg zinc for 14 days. Probiotics. Adjunctive therapy in acute diarrhea. Probiotics is the adjunctive therapy in acute diarrhea. Microorganisms that exert beneficial effects on human health when they colonize bowel. Probiotics are the microorganisms that exert beneficial effects on human health when they colonize bowel. As the patient will have diarrhea, the patient will be dehydrated, so we can do the rehydration, fluid rehydration if dehydration present. So in bacillary dysentery is caused by it is the infection of the intestine, which is caused by the Shigella and Salmonella, causing diarrhea that contains blood or mucus. Mode of transmission is fecal-oral route, and the causes are the eating contaminated food, drinking contaminated food, contracting dysentery from another infected person. The clinical features is that in stool there is blood or mucus. The patient complains of vomiting, abdominal cramping, bloating, high fever, weight loss, loss of appetite. On investigation, we do the stool routine examination, stool culture, complete blood count. Due to loss of blood in the stool, we can see the decrease in the hemoglobin, and due to parasite infection, we can see the eosinophilia. In blood test, we see the antibodies, colonoscopy to check bowel, and the treatment is and give antibiotics. If it is because of Shigella, then we give cotrimazole, and if it is because of Salmonella, then we give ciprofloxacin. We also give zinc, probiotics, and rehydration. This is all about the bacillary dysentery, which is also called shigellosis because it is caused by Shigella and Salmonella. You can find these notes on the Telegram, and the links are given in the description. Thank you.